class. Today we're going to be discussing evidence-based nursing practice. I reviewed the article regarding evidence-based nursing practice and the role of the nurse leader. As advanced practice nurses, as masters educated nurses, any form of an advanced practice nurse, we are leaders in change and innovation. We take evidence-based practice, we synthesize literature, we review the current standards and national evidence to support change in practice. As I have been working in a change of practice in the pre-admission testing department where I work, the discussion of evidence-based nursing practice applies completely to this project as a nurse leader in the area of work that I work, which is pre-surgical patients, preparing them for optimal surgery. The article that was reviewed today discussed barriers as nurses that we experience as we implement change. Not only are we leaders in finding the latest and current evidence-based practices for best outcomes, but we're also leaders in influencing those around us, the other nurses that work beside us, the managers that we work with. Some of us are managers. I've been a nurse for 18 years, and one of the most influential nurses I have ever worked with was one of my managers in the PACU area for 12 years. She was a leader of innovation. She stood up for her staff in ways that I've never experienced as a nurse. She taught lectures all throughout the world. She went to peri-anesthesia conferences and wrote in nursing literature articles, and we would review them, and she would ask for our advice and opinions. And she was probably the first nurse that I was able to firsthand experience how her influence impacted us as nurses. And she also inspired us, her staff, to be leaders ourselves in all the care that we gave our patients, in our conversations with surgeons and anesthesiologists. She gave us the baton of being a leader for our patients, even though we were not the manager or director of any of the services that we worked in. She definitely showed us through herself how to lead as a nurse leader. Today in 2020, and the times are changing, and innovation is needed like never before, and practices are changing quickly at a very fast pace. Since we are nurses that will have advanced practice degrees, we will take all that we have learned through all of our years of being a nurse and our bachelor's programs and our master's, and we will complete this course and be advanced practice nurses. And as I discussed, not only taking the literature and synthesizing best research, but taking all of that and applying it to the places that we work, impacting change to promote best outcomes, as the article that was reviewed, Setting the Climate for Evidence-Based Nursing Practice, What is the Leader's Role? I truly loved this article. The discussion of impacting your organization, the staffing, those around you, your direct environment, the discussion of barriers, organizational impact. As nurse leaders today, we are the largest employees for healthcare in the system, and we have such a great opportunity to step into roles to impact evidence-based change in our areas of practice. As I mentioned, I started a project in our pre-admission testing department. This project, I had to do a review of literature. This was a long, daunting process, but it opened my eyes to the importance of a literature review, and not only taking the evidence that nationally is being used already in some facilities and best practices to have our patients ready for surgery, but not just ready, but to be at their optimal health that they can possibly be before their surgery. And as a nurse leader, I took on this role to implement the new change within my place of work. developing a new workflow. We developed a new process of how we would do screening calls to help eliminate confusion with communication or communication breakdown. We're trying to prevent that, focusing on teach-back methods and health literacy. This project was only possible because we have leaders that I work with who are advocates for our pre-surgical population, that they want the best possible outcomes for these patients. I was able to be in a position as a leader in the pre-admission testing department. My manager had trusted me, and as a nurse leader, she knew that this project would be what was best for our unit. The nurses that I work with, as the barriers were discussed in this article, one of the barriers, change is always hard. We've done things a certain way, and remaining positive and reviewing why we're doing what we're doing. Advocating for what is best practice over what we've always done. Evidence-based nursing practice is taking all that we learn and putting it into our everyday practice, developing new processes and workflows that support positive change for our patients. I enjoyed this article, and I hope that this discussion will benefit you and that you'll realize the importance and the connection between not only learning what is best practice and research, but also implementing that as a nurse leader. We are nurse leaders today, and we have the opportunity to impact those around us. Thank you for listening to my discussion, and I hope you have a good night.